Hi there, I'm Sonal Mehrotra Kapoor, and welcome to the Moneycontrol live stream. Now, as we get into the last week of 2022, who would have thought? But well, we are talking about COVID one more time. You can almost smell the new year, but a lot of previous experiences that we've had with COVID are what we are seeing now in pictures emerging from China. There is enough floating around on social media, on WhatsApp groups, but just to reinstate what a lot of experts are saying right now, that the situation in China is very different from what the world will experience. So there is no need to panic. The issue at the moment is to stay alert, to stay vigilant as we get into the holiday season. Having said that, who better to understand on what the situation is and how it's unfolding, not just in China, but across the globe and here in India as well. I'm joined by Dr. Gagandeep Kang. Dr. Kang, welcome. Thank you so much for speaking with us. Like I said in the opening as well, there seems to be a lot going around in terms of visuals, etc. But there is no need to panic. Our obsession with COVID perhaps has made us all keep, every time something emerges, we get worried. People are still wondering if holiday plans they should really go ahead with. But it's pictures like these that have really brought in a major sense of deja vu. This is exactly what happened during the Delta wave in India, where there was lack of ambulances, long queues, people on the floor, of massive issues emerging, and the medical infrastructure really crumbling under the pressure of patients. This is exactly what we are seeing in China at the moment. But just to reinstate again that China very different from the world, and we've talked to experts and they precisely say this is because of several reasons. I just want to understand your take first on what you see unfolding in China.
So, Sana, what we are seeing in China is what has already happened in the rest of the world, except that in the rest of the world, we encountered infections over a slightly longer period of time. We have now almost 3 years of experience of the virus, which China did not have because of its very strict lockdown and testing and control policies. So while we have encountered the virus, we have had vaccination, we've been through all of this before, China is encountering the virus at the same scale with a very infectious variant, one that is more infectious than the Wuhan, the Alpha, the Delta that we saw before. They are seeing Omicron and variants of subvariants of Omicron in China now, in a population that has not experienced infection, even though a large proportion have been vaccinated. So it's numbers, and obviously, with a population that is well over 1 billion, we should expect that there will be lots and lots of cases, and lots of cases will mean, unfortunately, lots of hospitalizations for severe disease, just as is being seen in the visuals you just showed us.
Right. So essentially, it's a combination of a couple of things. One, the there being no herd immunity. Second, because China had a zero COVID policy, there was very strict norms there. Second, being the vaccination cover being almost less than one third, and those are figures that China has quoted. So we really have to take that with a pinch of salt. And third, perhaps the type of vaccine itself that has led to China being where they are at the moment. But having said that, some assumptions have been made and some numbers have been thrown out when it comes to the China situation. Numbers like 1 million projected deaths in China through 2023. Numbers like 1.6 million may die of COVID in China in 2023. Understanding the situation there, do you think that's the magnitude that we could see emerging from China?
So, one, you very correctly pointed out that China, unlike the rest of the world, does not have hybrid immunity, the immunity that comes from both infection and vaccination, which is actually somewhat more effective than having just an extra dose of vaccine. That's the fortunate situation that we are in India today, where we have both vaccination and we've had high rates of infection. So we should expect to see high numbers in China, but the estimates that have been made vary quite widely from somewhere around 300,000 deaths to well over a million deaths that might occur in China. Now, we have to remember that the people that are making these estimates are also the people who, for India, showed that India's actual number of deaths was anywhere from about 3 times to more than 10 times the officially reported figures. So, if we take that measure and look back to when India had its deaths, India reported deaths mostly in April and May of 2021, right? The estimate for that period for India by the people that reported high estimates was 40% of our deaths occurred during that time. And they have estimated deaths as high as 10 million. So, what they're essentially saying is that in India, in a 2 month period, we had at least 4 million deaths. Now, those people are estimating 1 million or more than 1 million for India. So, what does that really mean? I think all numbers ultimately you get to know what the real deaths are when you look at excess mortality after the event has happened, right? And we are not going to know China's deaths for a long time. We may never have a completely accurate number. But what we do know is that a lot of people are going to be hospitalized and a lot of people are going to die in China. And this might have been worse for China if China was really dealing with, as we dealt with, the most severe variant of them all, which was Delta. It's not that Omicron, as you can see, Omicron is not a mild variant. There is always a pyramid. But the most severe variant was always Delta. There hasn't been a variant worse than that. And in some ways, you can argue that China is lucky that it's dealing with Omicron at a time when there is some level of vaccination and they are dealing with a variant that is not Delta. Now, coming
Correct.
to what you said about vaccines and vaccine performance, I think this hype is going around saying all inactivated vaccines are rubbish. And actually, there are a number of inactivated vaccines that are in use, including the inactivated vaccine that has been used in India. Inactivated vaccines, we know before COVID itself that inactivated vaccines may not be the best in class vaccine, but they are not bad vaccines. So,
Correct.
whether it is the Chinese vaccine or the Indian vaccine or any other country's inactivated vaccine, even Kazakhstan has an inactivated vaccine. They are not vaccines that don't work. They work. They work to prevent severe disease and deaths slightly less well than vaccines that are made on other platforms. The mRNA vaccines clearly are performing the best for SARS-CoV-2, but after that, likely to be your protein vaccines, your adenovirus vectored vaccines, followed by inactivated vaccines. So deaths will be prevented, severe disease will be prevented, infection will be very hard to prevent. And in fact, for most Wuhan based vaccines, preventing an Omicron infection has been a real challenge. The protection seems to last a very short period of time after vaccination.
Right. I want to come back to the issue of vaccines, again. But first, just to sort of get a perspective on BA.7, this very notorious Omicron variant, which seems to have lots of cousins, which seems to have lots of variants. And, just to put this in perspective for our viewers as well, it's the same variant that has led to people, the same variant infecting people in India who've gotten well by simply home isolation and some symptomatic treatment, some of them even asymptomatic, and the same virus, the same variant then causing deaths in China. So this really, again, one goes on to point out the importance of immunity, whether it's naturally procured or through a vaccine. But second, just to break down this variant, right? We know that the R factor is really huge. It's about 10 to 18 last time we checked. If you could sort of talk to us a little bit about that. For our viewers, R factor is the rate at which the virus reproduces. That means the number of people it'll infect very, very quickly. So, and then there is the issue, three important issues of any variant, perhaps the immune escape mechanism it has, and then the virulency again, for our viewers, just to say on how dangerous will it be, how sick it will make you, in simpler words. Can we break down these parameters of BA.7?
Okay. Well, BF.7, and there is an alphabet soup and there is a number soup, but most of what we are seeing, almost all of what we are seeing in the world today, is Omicron and the subvariants that have evolved from the Omicron variant. These are being very well tracked across the world by sequencing. This is being done in India. As you pointed out, BF.7 has been in India. The XBB, which is the other one that people are talking about on WhatsApp, has also been in India for several months now. Now, in India, we have not seen a rise in cases. We have not seen a rise in people winding up needing to go to hospital over the past several months when both of these variants have been circulating. So this speaks to the fact that the Chinese population is a population that has not encountered COVID-19 before at the same scale that it is doing now. So this in itself sets China apart from India. Add on top of that the Indian population, we know, is reasonably well vaccinated. We know that this virus can cause a spectrum of infection, but who gets severe disease is really determined not so much by the virus or the subvariant, but by the person who is getting infected. So if you are elderly, if you have comorbidities, you are more likely to develop severe disease than if you are young and healthy. And vaccination gives you an added layer of protection. Having had a previous infection adds even more one layer to your armor. So you have lots of ways in which we are making sure now that the virus does not cause severe disease in large numbers of people in India,
Yeah.
unlike China.
But previous infection of Omicron or previous infection of any other variant as well?
So any previous infection is good. Having had an Omicron infection is even better, because a previous Omicron infection has been shown from data from the West to prevent even infection, not just an increase in protection against severe disease and death, but for up to a period of 5 months after you've had an Omicron infection, your chances of getting infected with a new variant of Omicron are much less than if your prior immunity was from having had a Wuhan or a Delta infection.
I see. So those who got infected in the third wave essentially are those who are most protected in a way at the moment, is what you're saying. And I love how you've put it out into different degrees and different layers of protection. One is, of course, your healthy immunity, then comes your vaccine protection, then comes your herd immunity or the natural infection that you must have gotten. There also, there are variants. Where does booster feature in all of this then?
So anytime you take an additional dose of vaccine, it pushes your immunity. Usually take it a few months after you've had your previous dose. It pushes your antibody responses up a little bit. Does it result in an increase in protection from infection, from disease? or from severe disease. What we know is that you do get protection from boosting for infection, particularly with the new bivalent vaccines that include Omicron. But this protection lasts only for a few weeks or months. So, protection from infection is very, very limited.
With the
The
booster.
in with a booster. Now, protection from disease or severe disease, that protection depends on who you are. So old people in general respond less well to vaccine. So giving a third dose or a fourth dose to an older individual has much greater benefit than giving a third or a fourth dose to a younger person, because that younger person is unlikely in the first place to get severe disease, right? So when you have elderly people at home, make sure that they get boosted. But it's not really necessary if you've been infected and vaccinated and you're generally healthy to think about a booster dose. I'm not saying don't take it. If you feel like taking it, go right ahead, because there is likely to be very little harm and some marginal increased benefit. If you want that, go ahead. But quite frankly, I wouldn't advise my children to boost too frequently.
I see. I see. So, young people, you're saying the advice is not to boost too frequently, but reserve that for the more vulnerable population at this point as well. Talking about the most vulnerable population, perhaps with Omicron, we've seen that those who are on some sort of immunosuppressants or immunocompromised because of medicines or treatments that they might be taking, especially cancer patients at this point. What would your advice to them be at the moment? We know that this is largely, remember, these are different times that we are dealing with. This was a population which was protected a lot more. Now we've become sort of, we're living with COVID, right? So the protection general layers and protocols not so much in place. So the government has obviously asked for it. What should these specific people be doing at the moment?
The immunocompromised are always vulnerable to infection. It's not just SARS-CoV-2. They are vulnerable to all kinds of infection, and therefore every way that they have of protecting themselves should apply all the time, right? So if it is a question of should you be wearing a mask, absolutely. When you go out in a crowd or you're meeting people you don't know, you should be asking them to mask up, or you should be masking up yourself if you are an immunocompromised person. Because essentially you have to protect yourself in the best way possible. The other aspects, which are the usual things that we heard about earlier in the pandemic, we don't hear about so much anymore, about hand sanitation, etc. Those apply all the time to people who are immunocompromised. So I think immunocompromised people are a special category where protection from infection continues to be important, whether there is a lot of SARS-CoV-2 around or not, because the only thing that we are protecting them against isn't SARS-CoV-2. We want to protect them against everything all the time.
Correct. And with the flu season on, especially in North India at the moment, which is very different, which has been a peculiar season for us because even general flu has lasted much longer. And the doctors here also have been debating about what exactly is going on. Allergies have lasted longer. One could say the smog has played a role as well. But be that as it may, at this point, I'm just trying to understand when people do get symptoms of the latest variant, the BF.7 that we've spoken about, when they get like a sore throat or they have a runny nose or they have headaches or diarrhea or fever. Uh, Generally, at this point, the advisory doesn't talk about it, and the mindset is that let's pop a pill and we'll be fine because we are boosted. What would your recommendation be? Should one get tested And if yes, then is it a rapid test or is it RT-PCR?
So, for young people, the likelihood is that if they have an infection, they will recover without complications. So, watching out for danger signs, feeling ill for a long time, fever not settling, respiratory symptoms getting really bad, that's where you require medical attention. What will you do with a positive test? What will you do different with a positive test? Now, in the West, they have ready availability of Paxlovid. So, for anybody who tests positive, you are likely to have access to Paxlovid, which isn't really the case in India. It's much more challenging to get, right? But if you're not going to do anything different because you got a test and you were tested positive, then my approach to this is, why bother testing if you're not going to take action based on the test, right? You're not going to predict the severity of disease. You're not going to change any kind of practice. So, testing in the current circumstances seems not appropriate to me. That is not to say that no testing should happen anywhere. I think it's very important that if you have anybody who has severe respiratory acute infection, what's called SARI, there should be testing that happens, because severe infections, we want to know what proportion of the severe infections are caused by what. And here is where multiplexed testing is important. You mentioned flu. If I gave you 100 patients who came to hospital needing admission, would you know what proportion are flu, what proportion are bacterial infections, what proportion are other viruses, what proportion are SARS-CoV-2? It's important from a public health perspective for us to understand what's causing severe disease at this time in our country. And it shouldn't be focused on one thing. It should be on what are all the things that we have, so that we think about how do we manage this better tomorrow. We know that there are influenza vaccines. We don't give them to our population. Had we given them, would we have seen less of the bad flu that you just described in the country today?
Right. I get your drift over there. But one of the reasons I asked you this is I was speaking Dr. Guleria also on the same matter yesterday, and he seemed to have a slightly different opinion, and he was coming more from a variance watch perspective, which, like we know at the moment, is going to be the next big thing. We got to stay vigilant, and by a lot of that vigil will come from watching out for the next variant that might emerge. This very notorious virus, like we say, keeps emerging and is fighting its own battle. That happens. How are you seeing the mutation now? And especially, I wanted to understand, especially since it's going through a population which is unvaccinated in China. It's passing through people who have not seen an infection. And, viruses have their own very peculiar journey. But how are you seeing the trends in 23 when it comes to the variants?
So, right now, what we were talking about was from a clinical perspective. What would you do? What should somebody in your family do if they get infected? And that's why I pointed out that testing without action has little value. But when you get to a hospital, you do want that testing to be done. And absolutely, I agree with Randeep that making sure that we have a tracking of variants is critically important, but that's a public health function. That is not necessarily a clinical function. Where the clinical function comes in is to be able to marry the clinical picture with the variant information. So, having a detailed understanding of what the pattern of severe disease is, that will come from the hospital, and which variant is causing what kind of disease comes from the sequencing that gets done through networks like INSACOG, and the two have to talk to each other. And this is something that happens better in other parts of the world than here. But hopefully that will improve. Tracking variants is critically important because you want to be able to see what is happening with those variants elsewhere, or you want to be able to tell the world this is what is happening with the variant for us. So I'll give you the example of what happened with Omicron. When we first saw the sequence of Omicron, everybody was desperately worried. How did this completely new variant emerge? It wasn't on any branches of the evolutionary tree of SARS-CoV-2. New variant, 47 new mutations in the spike protein. What is it going to do to us? But that worry in 2 weeks was resolved by the data that South Africa provided, saying, hey guys, relax. This is putting a lot of people into positive tests, but our hospitals are not filling up and people are not dying. Right? So then we knew that when Omicron comes, it will be something that spreads rapidly, but will not necessarily be something that causes severe disease and kills a lot of people. So, it does kill a lot of people, as all viruses do, but the people that it affects the most are the ones that we knew already to be vulnerable. This
Yeah.
wasn't a more severe variant than Delta.
Right. So again, but this is if you're vaccinated, and this is if you have immunity, because we're seeing the same Omicron play a very different role in China, of course. But let me come back to my question of how worried are you about new variants emerging? We've seen trends in the past, and we've seen lots of reports now pointing out that the fights of the future are going to be all about new viruses emerging, new things happening. But that's a separate topic, perhaps. Only when it comes to SARS-CoV, how are you seeing variants? Because that's the next big challenge that I keep hearing from doctors and virologists also in India, that we got to watch out for that. We need to be prepared for those new variants, line our vaccines according to those variants. So, and like I said, as it's going through a new population and travel is going to continue, there is always going to be trickling down. We're not going to close down the world, hopefully. So, your thoughts?
So, two things I'll point out. Variant watching is very important because we need to assess how they are spreading and what the potential of those variants is to cause upsurges in disease in different places. Now, any time the virus replicates, there is the potential for the emergence of new variants, right? The more the virus replicates, the more the chances that you will have a new variant emerge. And in China, we are going to see a lot of replication now. So, will a new variant come from China? It's possible, it's not a guarantee. That's why watching is very important. Now, variants can come in two ways. One can be what we've seen this whole year, which is that your branch is essentially Omicron, and what you're getting is new twigs being put out each time, which is a new subvariant. The question is, will we see a new branch? Delta was a new branch. Alpha was a new-ish branch, right? Omicron was a completely new branch. Will we see new twigs or will we see new branches? That's something that we need to wait and watch for. Now, when it comes to vaccines, what we've seen with the monovalent vaccines and the bivalent vaccines that are in the rest of the world is that the bivalent vaccines offer an incremental benefit. That benefit is the greatest in the oldest individuals. These are data that have come out recently. But is that incremental benefit sufficient for us to say that we now need a vaccination program for the whole world to vaccinate them against Omicron? because so far, all of us have been vaccinated against Wuhan. We have
Hmm.
not been vaccinated against Omicron. What
Hmm.
the West is doing now is using bivalent boosters,
Hmm.
which contain both Wuhan and Omicron, or in Europe, they also have a monovalent Omicron alone.
Hmm.
But is that what we need to do? For
Hmm.
me, the question is between individual benefit and population benefit. Individually, the data show that if you are an older individual, you will derive more benefit than a younger person.
Hmm.
And if you have the resources, you want to take the vaccine, as I said previously, go right ahead. Not a
Hmm.
problem.
Hmm.
Problem is when it comes to populations, how much benefit will we derive by
Hmm.
vaccinating the entire population against one variant of a virus against which we already have a reasonable degree of immunity? It's
Hmm.
not going to cause severe disease or death on the same scale as if our populations were completely unvaccinated,
Correct, correct.
right?
Before you say further, I just want to educate our viewers, those who are getting confused by bivalent vaccines. It essentially means, and correct me if I'm wrong, doctor, essentially covering a spectrum of not just the Wuhan main virus, but a spectrum of the other variants that have also come in, and not just one. And in India, we don't
It's
have
yeah, it's
one.
only Wuhan and Omicron.
Correct.
So Pfizer and Moderna have made vaccines on the mRNA platform that consist of both Wuhan and one Omicron.
Hmm.
And in Europe, they also have an Omicron alone booster that has been given to some people.
Hmm. And in India, the situation is different, of course.
In India, no bivalence, no
Hmm.
Omicrons.
Yeah. So both Covishield and Covaxin that we have only deals with the Wuhan virus. And perhaps that's why you said that those who got infected in wave three will have that natural booster automatically. Sorry, please go ahead, ma'am. I just wanted to clarify
No,
that for our viewers.
I think you've said it all, but essentially, there is a trade off whenever you bring vaccines into a public health program. So, if I vaccinate against SARS CoV 2 now, how much benefit will I get in terms of preventing deaths, preventing hospitalizations, etc., versus using that same money and
Hmm.
treating tuberculosis or treating cancer, right?
Hmm.
Governments have to make choices. So, at the individual level, if you can afford it, get vaccinated, boosted as often as you want, up to you. But at the country level, I think this is something where we need to consider what the opportunity costs might
Hmm.
be if we go for this and don't do something else.
Right. Can I last question, just to sort of sum it up and looking ahead? A lot of doctors obviously have said that with the incubation period also coming in, the first half of January is going to be crucial for India. Travelers will come back. There might be a surge in infection. Also, those who have been infected will perhaps start showing symptoms by then. So first week and first couple of weeks of January and first month, of course, of the year is going to be slightly crucial to watch out for. As we do that, at the moment, in case Adat Poonawala has also tweeted talking about the relevance of boosters, talking about how things are going to move on. But what is your understanding in case we were to see a more virulent strain come in through the course of the next year? What exactly should be our outlook? How do you think we should be approaching it?
Um, I think it isn't just the first 2 weeks of next year. I think this is a public health function that needs to stay in place all of the time. Any time that there is a cluster of infections, that's something that needs to be investigated and action taken about it. Anytime the situation changes in the rest of the world, it is something that we need to watch. What we need running in the background is a stable level of surveillance that has surge capacity. So if the problem is, if you do surveillance and today I test 10,000 samples and tomorrow I test 12, and then the day after that I test 1 million, how do I know what results I should be relying on? So maintaining stability, having a baseline is really important. And the easiest and best way to do this for respiratory viruses is what I said before. Keep tracking what happens to SARI surveillance, right? SARI is severe acute respiratory illness, people who get hospitalized for respiratory illness. What is the proportion that is being caused by this virus or that virus? The other way, if you want to do it, which is more complicated and difficult, is to also add in outpatient surveillance for what is called influenza like illness. People who come in with coughs and colds, is it flu that is causing it, or is it SARS-CoV-2 or something else? So you can look at severe disease, you can look at symptomatic disease. As long as it is not a random process, it is a designed process that stays stable over time, you will see patterns. And when that pattern starts misbehaving, is unpredictable, you're seeing something you shouldn't, you will recognize it because you've gotten used to the pattern. That's why stability is important, because, as I mentioned, 10 today, 1,000 tomorrow, and
Yeah.
100,000 the next day doesn't give you stable information. So,
Right.
and then that stable system should have the capacity to respond. So, clusters, increases that are seen in different parts of the country or in, at different times of the year, how do we respond to all of that? So that's
Right.
surge capacity in surveillance.
Right. So, just wrapping up our conversation today and key takeaways, then, Dr. Kang, you're essentially again underlining that there is no need to panic just yet. We need steady, stable surveillance to watch out for new variants that might emerge. I loved how you said that it could be a new branch, could it be a new variant, or could it be sort of a new lineage or sub variants coming out of Omicron itself? That will define. You've also talked about boosters being extremely important, perhaps to those who are most vulnerable. The others don't have to get on a panic mode and start hoarding boosters, perhaps, and taking them, especially the younger people. And also, then you've talked about the beauty of ensuring that you're generally healthy and other viruses are also sort of kept in check. So thank you so much, Dr. Kang, for joining us here and giving us your time and so much knowledge about what exactly is happening. We wish you also a very happy new year, safe one, and hopefully 23, we're gonna, I don't know if we can say bye-bye to COVID ever, but at least in 23, we will not see a repeat of that horrid time again. That's the only wish perhaps that everybody has.
Thank you very much.
Thank you. And to all of you, stay tuned to Money Control, lots more coming up.